All right, so the last section is emerging infections. An emerging infectious disease is an infectious disease whose incidence has increased in the last 20 years and threatens to increase in the near future. Now, the West Nile virus we're going to talk about, usually in tropical and temperate regions of the world, is transmitted by the bite of an infected mosquito through blood products, breast milk. Now, we have seen in some of the warmer temperatures, more temperate regions in the United States, we have seen this. The symptoms are mild to asymptomatic. They could be flu-like symptoms. Usually, signs and symptoms are going to be, like I said, flu-like symptoms. When it becomes more serious, they're going to have fever, severe headache, decreased level of consciousness, tremors, seizures, and paralysis. Incubation period is usually 2 to 15 days. Now, it may last for weeks, but it's rarely fatal. Sometimes the neurodeficits, though, may be permanent. Now, it's more severe in older adults, and so they are more apt to have problems from the disease. Legionnaire's disease is caused by Legionella bacteria. It can be inhaled from contaminated water supplies, such as humidifiers, AC vents, contaminated respiratory therapy equipment. Starts with signs and symptoms of fever, chills, cough, fatigue, headaches. Usually progresses to pneumonia. Those who are going to be at risk for that are going to be the middle-aged or older adult smokers, those with COPD, or those who are immunocompromised. Now, usually they do ABGs as a lab test to diagnose this. Treatment is going to be through antibiotics and respiratory care. A lot of times these patients are going to end up on a ventilator for a while. Lyme disease occurs when someone is bitten by an infected deer tick. Causes systemic infectious disease. It's the most common vector-borne disease in the U.S. It's been seen especially in the summer months. Now, early detection, there's a test for the disease within 4 to 6 weeks after the bite. Now, stage 1 symptoms are going to be early or localized. The symptoms usually begin within 3 to 30 days. But most symptoms are present within 7 to 14 days. Now, the symptoms are going to be flu-like symptoms, erythema, migraines, round or oval, flat or slightly raised rash. Usually only one lesion or a bullseye lesion is noted. There's going to be pain and stiffness in the muscles and joints. Now, treatment for this is going to be antibiotics, usually doxycycline, amoxicillin. Antibiotics are used in this uncomplicated stage, but even without treatment, symptoms tend to disappear within 4 to 5 weeks, but the problem still exists. So if not treated, or if it's unsuccessfully treated, the prognosis to more serious complication occurs, which is stage 2, which is early disseminated. Occurs 2 to 12 weeks after the bite. Usually occurs signs and symptoms of carditis with dysrhythmias, dyspnea, central nervous system disorders, dizziness, palpitations. Now, the central nervous system disorders that can occur is meningitis, facial paralysis, a mixture of Bell's palsy or peripheral neuritis. Now, treatment is going to be antibiotics, ceftriaxone, for at least 30 days. Remember this slide 163, this round rash, okay? Could see that again somewhere. Stage 3 is going to be your late or chronic or persistent stage. If no diagnosis or treatment in the early stages, chronic complications are going to occur. So your chronic complications are going to be arthritis, chronic fatigue, memory and thinking problems. Stage 3 occurs months to years after the bite. Arthritis may be the first and only sign of Lyme disease for some patients. In some cases, the diagnosis doesn't respond to antibiotics in any stage, leading to permanent joint and nervous system damage. Now, prevention is the best strategy. So teaching people, to watch out for ticks, to examine themselves, to wear, if they're going to go into areas like that, they need to wear long sleeve, long pants, some type of thing that will protect them from getting ticks. Now, the Ebola hemorrhagic fever, or the Marburg virus, green monkey, also known as green monkey disease, the Ebola virus or the Marburg virus are related viruses that cause hemorrhagic fevers. Illnesses are marked by severe bleeding or hemorrhage, organ failure, and in many cases death. Both the Ebola and the Marburg viruses are native to Africa, where sporadic outbreaks have occurred for decades. Now, the Ebola virus and Marburg virus live in animal hosts or in humans, and humans can contact the viruses from infected animals. Now, after the initial transmission, the viruses can spread from person to person through contact of body fluids or by contaminated needles. Now, your signs and symptoms are going to be sudden fever, weakness, headache, muscle pain. Then you're going to have nausea and vomiting, diarrhea, internal and external bleeding. Now, no drug has been approved to treat Ebola or Marburg viruses. People diagnosed with these viruses receive supportive care and treatment for complications. They're put on standard precautions. There's a 50 to 90% mortality rate with these viruses. Now, SARS, or severe acute respiratory syndrome, it's a new respiratory infection that was first identified in China in late 2002. It's acute viral respiratory infection caused by the coronavirus. A new coronavirus this virus family causes many forms of the common cold. SARS is a more virulent and mutated form of the coronavirus. Now, it easily spreads by airborne droplets, coughing, sneezing, talking, contaminated surfaces. It infects the cells of the respiratory tract, causing inflammatory response, and the virus itself stays in the respiratory tract rather than spreading to the blood. Now, signs and symptoms are going to be usual respiratory signs and symptoms. Fever greater than 100.4, your headache, general aches, mild cold signs and symptoms. They will develop a dry cough, which is and have difficulty breathing within usually the first 2 to 7 days. Now, more severe cases are going to have hypoxia, cyanosis, and decreased O2 sat. Now, people at highest risk are those in direct care with an infected person, direct contact with an infected person. The virus enters through the mucous membranes of the eyes, nose, and mouth. Now, the more severe forms, like we said, are going to have hypoxia, cyanosis, decreased O2 sat, and they're going to be usually on a ventilator. Now, treatment is going to be, there is no effective treatment. You're going to have supportive care. Now, standard antibiotics and antivirals are ineffective against the virus and its replication. Supportive care, talking about respiratory treatments to dilate the bronchioles. Sometimes these people are going to be intubated and on a ventilator. Chest x-rays are going to show a pattern similar to pneumonia. Diagnosis is made through the symptoms presented in the rapid SARS test that detects the coronavirus, RNA in the blood within 2 days after the symptoms begin. So prevention, they're going to be on airborne and contact isolation. Hand washing is going to be used, and you're going to have a particulate respiratory mask for dealing with patients with this. Now, your avian flu is a flu infection of birds. The virus that causes the bird infection can mutate and infect humans. The first avian influenza virus to infect humans occurred in Hong Kong in 1997. The epidemic was linked to chickens and classified as avian influenza A, or H5N1. Now, human cases of the avian flu have been reported in Asia, Africa, Europe, Indonesia, Vietnam, the Pacific. Hundreds of people have become sick with this virus. Slightly more than 60% of those that have become ill have died. Those that are at a higher risk for developing the bird flu are going to be farmers and others who work with poultry, travelers visiting the affected countries, and those who touch an infected bird. Those also who eat raw or undercooked poultry, meat, eggs, or blood from the infected birds. So healthcare workers in contact with patients with the avian flu are going to be at risk. Signs and symptoms are going to be a cough, dry or productive, diarrhea, difficulty breathing, fever greater than 100.4, headache, malaise, muscle aches, runny nose, sore throat. The avian flu can survive in the environment for long periods of time, so infection can spread simply by touching contaminated surfaces. Birds who are infected with this flu can continue to release the virus in their feces and saliva for as long as 10 days. So a lot of times you'll see these animals being killed just so they won't have it. They won't spread it. Now, your treatment, different types of avian flu viruses may cause different symptoms, therefore treatment can vary. In general, treatment is done with antiviral medications such as Tamiflu or Relenza. These may make the disease less severe if you start taking the medication within 48 hours after the symptoms start. The virus that causes the human avian flu appears to be resistant to any kind of antiviral medications. Such as amantadine or ranitidine. Therefore, these medications should not be used if the H5N1 outbreak occurs. Now, people with severe infection may need to be placed on a breathing machine or a respirator. Experts recommend that persons diagnosed with avian flu be put in isolation. Now, doctors recommend that people get an influenza shot to reduce the chance of an avian flu virus mixing with the human flu virus, which would create a new virus that may easily spread. Now, the U.S. Food and Drug Administration has approved a vaccine to protect humans from the avian flu. And experts say that the vaccine could be used if the H5N1 virus starts spreading between people. So, let's start a little pop quiz. Identify 4 of the 10 techniques nurses use to prevent infections? Okay. What disease does this insect transmit? You'll have to see the slides to identify these. With what disease would you see this skin marking? Okay, this is going to be a visual, so you're going to have to look at these slides if you're going to answer any of these questions. What are the major symptoms caused by this bacteria? Number 5 is identify this viral infection. Number 6, what is this besides gross? Okay, that's it for your immune system integrity. We will be having study guides sessions, so make sure you're there for those. Those will help out a lot. If not, you're going to have a lot of integrity and outlines to sort through. So good luck.